Okay, A to Z of emergency medicine. B is for Balfaxar. Now, Balfaxar is the new to the US brand name for Kcentra. Kcentra, or Balfaxar, is the 4-factor prothrombin complex concentrate reversal agent for Coumadin, warfarin, Jantoven, or the 10A inhibitors, most commonly Xarelto and Eliquis or Apixaban. It supplies the 4 clotting factors that are blocked in Coumadin warfarin, which is factor 2, 7, 9, and 10. Factor 10 is the clotting factor that is specifically reversed or blocked in the 10A inhibitors, Xarelto and Eliquis. There is a specific reversal agent for the 10A inhibitors. Having said that, it's not available in probably 75 to 80% of hospitals around the US because of cost and because of other things related to how it's dosed and its duration of action, that sort of thing. And so Kcentra, or Balfaxar, is our most common go-to agent. It has changed, its dosing has changed since the drug first came out, and so the package insert dosing is not what is most commonly used these days. The guidelines do not reflect package insert dosing, and so pharmacy at most facilities will adjust the dosing to be instead what the doctors order, which most commonly is reflective of the package insert dosing, to now be reflective of the guideline dosing. And so fixed dose instead of weight-based dosing, especially for lower INRs less than 5, for life-threatening bleeds, are what you'll most commonly find. The other thing is we use the highest dose possible for factor 10 reversal because we're only using one of the 4 clotting factors that are in the drug. So again, it supplies 2, 7, 9, and 10, but for reversal of Xarelto and Eliquis, we're only using factor 10, so one of those 4 clotting factors. And so we use the highest dose of the drug possible to get the most bang for our buck. And so we'll use 50 units per kilo. That's really the most important thing, that sometimes dosing will change, specifically based on what you might find if you try to Google dosing or look it up in things like Micromedics or Lexicomp or Epocrates. And that's because guideline dosing oftentimes takes precedence or has changed since the drug came out. And so that's Balfaxar, which is another brand name for Kcentra, or 4-factor prothrombin complex concentrate, PCC, which are the reversal agents for Coumadin, warfarin, or the factor 10A inhibitors. B is for Balfaxar. Farm ER.